Hello, my name is Mary Carver. I'm an adult nurse practitioner and a certified diabetic educator. I propose an environmental control similar to what has been done with smoking. Rangel and Williams in the Journal of Public Health report there's a large body of evidence that demonstrates higher cigarette taxes reduce the total smoking and smoking rates. I suggest Texas start taxing sugar-sweetened beverages and beverages with high fructose corn syrup. Healthcare providers must find a way to turn the diabetic epidemic around. Sagini and White propose that DNPs should influence healthcare policy and it should be based on scientific recommendations to improve care. A thorough literature review is obvious. It's obvious that high fructose corn syrup has significantly contributed to the diabetes and obesity epidemic in America. Nurse practitioners are experts at caring for diabetics. A recent research article in Strickland et al. Demonstrated that family practices with nurse practitioners perform better on diabetic measures than family practices without nurse practitioners. American Academy of Nurse Practitioners reports that 87% of nurse practitioners already care for Medicare patients and 84% of nurse practitioners care for Medicaid patients. These populations are the ones most at risk for diabetes and obesity. The CDC reports that the total cost of diabetes in the United States is $174 billion. $116 of this is in direct medical costs. $58 billion is in short-term and long-term disability work loss as well. NHANES data estimates that in 2010, 79 million adults were pre-diabetic. The same data reports that a third of adults were obese during that time and 17% of youth were obese. Many sources report the increased consumption of high fructose corn syrup since 1975 directly correlates with the obesity and diabetes epidemic in America. High fructose corn syrup is not metabolized the same as glucose. It does not stimulate insulin or leptin, and it does not inhibit ghrelin the same as glucose. It also increases uric acid production, which contributes to hypertension. I highly recommend a YouTube video by Dr. Robert Lustig that details the fructose metabolism in the body. It's entitled Sugar, the Bitter Truth. Just one sugar-sweetened beverage a day can cause a 15-pound weight gain a year. High fructose corn syrup causes leptin resistance, resulting in people overeating and becoming obese. Chronic fructose exposure leads to metabolic syndrome. Lustig proposes that fructose is a chronic hepatotoxin. He reports that glucose, not fructose, is the energy for life. Just this month, the Journal of Circulation has a research article, Koenig et al., that shows the top quartile of fructose consumption have a 20% increased risk of coronary artery disease compared to the bottom quartile of fructose consumption. A similar tax is being proposed in California. Senate Bill 1210 will be heard May 12, 2012 by the State Senate Review and Taxation Committee. It is estimated to earn $1.5 billion for the state of California. I feel like Texas could impose a similar tax, and this would help treat our diabetics as well as help prevent diabetes. The ultimate goal of the tax would be to prevent high fructose corn syrup consumption as well as decrease diabetes and obesity rates in Texas. The stakeholders for this tax proposal would start with the Texas Diabetes Council. It advises the legislature on issues regarding diabetes. In fact, a nurse practitioner is the vice chair on that council, and her name is Gina Bell. She's also a certified diabetic educator. I'd like to include Texas Nurses Association, Texas Nurse Practitioners, Texas Medical Foundation, and the Texas Dietetic Association. Thank you for your attention.
Now
Here's my helper.